Hello, everyone. Happy Friday the 13th, and welcome to another Medical Director Minute. I apologize for skipping last Friday. I had a struggle getting my act together last week, clearly, so I decided to lay low, wait for today. A quick note of congratulations to celebrate Dr. Abdel Jabber, who graduated with his master's degree in healthcare administration. Nice work, Abdel. Happy to celebrate you. And then next week, I wanted to highlight Wednesday, October 18th, because that is Advanced Practice Provider Day at Carle Health. So if you work with one of our advanced practice providers, make sure you take a moment to recognize and support them next week. Specifically, you could recognize and celebrate our own Nikki Methi next Friday, since it's her birthday next Friday. She's not working that day though, but she's working the day before. You can celebrate her then. Last night, I got on Zoom for virtual support rounds. The previous two times, no one joined. That's okay, no big deal. But last night, I had my first victim. Dr. O'Connell from the NICU signed on and joined me, and we had a chance to chat and, talk through whatever and ask questions and catch up. So I have to send a thank you to him for keeping the dogs and I company last night. Anyone can join in, and the next one will be November 10th, and I'll make sure everybody has the link before then. Really, it's just a time to, if you have questions about what's going on in the service line or what I know about, with other big projects that are happening, or if you have a case you want to talk through, whatever you need. So don't wait for then if you need to book time with me. Use the booking link in this week's email to self-schedule some time with me. You can also get to that same booking page through the SharePoint site, and it just scrubs my schedule and finds an open spot and puts you in there. So go there if you want to schedule some time with me. If you do go to the SharePoint site, you will notice some new content this week. I'm hoping to keep that updated as I can, so that it's a useful resource for everyone to visit again and again. In addition, there are new sites for each individual division, one for inpatient peds and PICU, one for NICU, one for gen peds, one for peds specialty. But they're not ready for everyone yet. So I've asked the leadership teams from each division to help me work on some useful content for those. So stay tuned, there's more to come. In the meantime, is there something you want to see on the hub site, the SharePoint site for the service line, or is there something you'd like to see on your individual department SharePoint site? Do you have a cool idea, but you're just not sure how to implement it? Just go to the SharePoint site, and there's a form on the right-hand side where you can request content. Not sure if your idea is possible? P.S. I probably don't either, but I'll do my best to find out and see if we can put it on there. Shifting gears, one item to bring to the attention of all the docs and advanced practice providers in our service line. The upcoming provider engagement survey will be sent out to folks next week, October 17th. Now, in 2022, I went to great lengths to compile all the data and get it out to leaders so that we could come up with some plans together. But I feel like the process slowed down and then stopped at certain points. And while I had good intentions of putting strong action plans in place, I feel like the process fizzled out before we could get more done. We still addressed a number of things, but I still feel like I could do better. So that's my goal for this year. I can only do that, though, if I have enough volume of strong, honest data and feedback to work with. So please take your time, be honest and thoughtful when you fill those out. One separate bit of clarification I wanted to add today applies mostly to our inpatient providers. The rules have changed a bit in Illinois in the law when it comes to facilities reaching out for advice. If a child is being transferred to us, or if they're being discharged home from a referring hospital and that hospital calls, and they're asking for help or advice, this doesn't apply. And you can continue on in the way you always have, just with the phone calls and Carle Direct. The change would be that if that facility doesn't routinely admit pediatric patients or have pediatric resources and they call for advice because they are going to admit a pediatric patient to their facility, that now must be a telehealth consult, and there must be documentation and a charge placed. This is not going to be a frequent occurrence. It's not going to happen very often, but it may happen from time to time. So since it's not very frequent, I asked them to make some examples and cheat sheets to put up on the wall in the provider workroom in North Tower 8, so that if you ever need a refresher, when you get one of those calls, then it's up there so you know what you're required to do. All right, friends, that's more than enough for one medical director minute. That turned into more minutes, but usually does. Hope that you are enjoying spooky season, and I will see you next week. Until then, you better be working on those costumes, you animals. See you soon.